A arrow lodges between your ribs, not deep enough to pierce the lung, but deep enough that every breath sends a spike of white-hot pain down your right side. You're 5 miles from camp. It's late afternoon. You're bleeding, you're alone, and the wound is already starting to throb in a way that makes you think about things you'd rather not think about. What happens next determines whether you die in this forest or whether you live long enough to see your family again. This scenario played out thousands of times across human history, and not all of those people died. Some of them got lucky. Some of them died anyway, but a significant number of them recovered. They walked back to their camps, worked through the pain for weeks or months, and eventually returned to their lives bearing nothing more than a scar and a story. We know this because the skeletons don't lie. Paleontologists find evidence of ancient injuries that healed, broken bones that mended, scalp wounds that closed, infections that cleared. People were surviving catastrophic trauma in environments where infection should have been a death sentence and anesthesia didn't exist. The common assumption is that this was pure luck combined with some kind of animal-like pain tolerance that modern humans have somehow lost. That's almost entirely wrong. The truth is more interesting. Ancient humans didn't survive massive injuries because they were tougher or more stoic. They survived because their bodies possessed biological mechanisms we've largely forgotten we have, because they possessed a surprisingly sophisticated toolkit of compounds and techniques, and crucially, because they existed within social structures specifically designed to keep injured people alive. In other words, survival from catastrophic injury in the ancient world was never an individual achievement. It was a collective technology, and understanding how it worked tells us something uncomfortable about what we've traded away in the name of modern medicine. Let's start with the biology, because this is where most people completely miss the point. When you get severely injured, your body doesn't wait for you to make a decision about survival. It goes into a cascade of automatic responses that are specifically designed to keep you alive long enough to get somewhere safe. The first thing that happens is shock, and I don't mean shock in the colloquial sense of being surprised. Shock is a physiological state where blood vessels constrict, your heart rate increases, and your nervous system essentially undergoes a controlled shutdown of non-essential functions. Your digestive system stops working. Your immune system downshifts. Your cognitive processing narrows. Everything that isn't directly related to immediate survival gets throttled back. This isn't a bug in your system. It's a feature. When that arrow entered your ribs, your sympathetic nervous system activated. Adrenaline flooded your bloodstream. Your pain perception shifted into a weird, muted state where the injury still hurts, but it doesn't hurt the way it would if you were sitting at home reading a book and somebody pinched you. This is partly because of adrenaline itself, but also because your body releases endogenous opioids, actual pain-killing chemicals that your brain manufactures. Anesthesia didn't exist in the ancient world, but your nervous system carries its own pharmacy. Here's the thing that modern medicine often misses. This survival response only works if you stay still. Movement, exertion, and panic amplify blood loss and overwhelm the body's ability to compensate. So one of the first things an injured person in the ancient world would do, consciously or unconsciously, is immobilize. They'd find shelter. They'd lie down. They'd reduce movement to the absolute minimum necessary for survival. This isn't something they had to learn from experience or instruction. This is what your body naturally wants to do when it's badly hurt. A broken leg seems like a death sentence if you're alone in the wilderness. Except humans have femurs that are disproportionately thick for our body size compared to other primates. We're built for bipedal endurance, but that same architecture makes our long bones incredibly difficult to break completely. Fractures that look catastrophic on an X-ray often healed reasonably well in ancient populations because bone, unlike soft tissue, doesn't require sterile conditions to mend. It requires immobilization and time. Paleontologists have found evidence of people recovering from femoral fractures that would have required months of complete immobility. That's a long time to be helpless. But if your community was willing to carry you, feed you, and move camp around you, which they were, then you could survive. Now let's talk about what ancient peoples actually knew about infection, because this is where they get undersold the most. Infection is a threshold phenomenon. Below a certain bacterial load, your immune system can handle it. Above that threshold, it becomes sepsis and you die. The gap between those 2 points is where everything happens. Antibiotics don't kill all bacteria. They suppress bacterial growth long enough for your immune system to catch up. In the absence of antibiotics, the strategy becomes preventing bacterial growth from crossing that threshold in the first place. Honey is antimicrobial. This isn't a folk remedy that happens to work through placebo. Honey creates an osmotic environment that suppresses bacterial growth. It's been used to treat wounds for at least 4,000 years in written records, which means it was probably being used long before anyone wrote it down. Boiling water is antimicrobial. Fire, applied carefully to wound edges, cauterizes vessels and creates a sterile barrier. Certain tree barks contain compounds that inhibit bacterial growth. Willow bark contains salicin, a precursor to aspirin. Meadowsweet contains salicylate. Opium poppies contain alkaloids that are genuinely effective pain management. None of this was accident. Archaeological evidence and ethnographic studies of more recent hunter-gatherer societies show systematic knowledge of plant compounds and their effects. Were ancient peoples doing chemistry in the modern sense? No, but they were doing something that worked. They were applying compounds that reduced infection risk, managed pain, and supported immune function. A hunter with an infected wound would receive treatment that actually did something. Not because the treatment aimed to cure infection through understanding germ theory, but because the treatment suppressed the conditions under which infection thrived. The other piece of this is the social structure itself, and this is crucial. Modern medicine places enormous emphasis on individual intervention, the surgeon, the antibiotics, the procedure. But in the ancient world, injury recovery was a collective project. An injured individual didn't return to normal function because they underwent treatment and then resumed their previous role. They returned to normal function because the entire community redistributed its labor to accommodate their recovery. Think about what this means practically. If a woman's leg is fractured, she can't forage. In a foraging society, that's not just inconvenient. It's a fundamental loss of productive capacity. But a community with surplus capacity can absorb that loss. One person shifts their foraging route to cover additional ground. Someone else moves their child to help with water collection. The injured person's family gets additional shares from the kill. Children who would normally be minding their younger siblings get reassigned to other tasks. These aren't individual acts of generosity. They're systematic redistribution designed to ensure that the injured person gets through the vulnerable period without becoming a drag on resources. This is more effective than it sounds. A study of the Tsimane people in Bolivia, a population that still relies substantially on foraging and hunting, found that injury recovery rates are remarkably good despite lack of access to modern medicine. Why? Partly because of the biological factors I mentioned, but significantly because of the social structure. The injured person doesn't have to choose between recovery and starvation. The community makes that choice for them. They're fed while they heal. They're protected while they're immobile. They're integrated back into productive function gradually, not abruptly. Compare this to modern industrial society, where the injured person is often left to navigate recovery alone. They might lose income. They have to figure out how to manage medical costs. They have to navigate returning to work. The social scaffolding isn't there. We've replaced it with insurance and disability payments and FMLA, which are genuinely useful systems. But they're not the same as being integrated into a community that literally exists to keep you alive. Now, before this starts sounding like I'm arguing that ancient people had it all figured out, we need to talk about the massive death toll that injury carried. Not everyone survived. Probably most people didn't. Infection was catastrophic when it took hold. Injuries to the abdomen, the chest, deep lacerations. These were often death sentences. Skull trauma killed people. Shock itself killed people if it was severe enough. The mortality rate from serious injury in the ancient world was genuinely terrifying. An estimate from skeletal trauma studies suggests that somewhere between 20 and 30% of individuals in pre-industrial societies died from traumatic injuries. That's horrifyingly high. What we're not seeing in the archaeological record are the people who died. We see the survivors, the skeletons with healed fractures, with evidence of old wounds that closed. But for every skeleton with a healed femoral fracture, there were probably 5 or 10 skeletons of people who broke their femurs and died. We don't know about them because bones that were never given a chance to heal don't show up the same way in the record. This matters because it changes the entire framing of the question. Ancient humans didn't survive massive injuries despite lacking medicine. They survived through a combination of biology, knowledge, and social support. But that combination still had a failure rate that would be unacceptable by modern standards. Someone could do everything right, stay still, apply the right compounds, have a community that supported them, and still die from a wound infection or hemorrhage they couldn't control. Modern medicine isn't just a technological upgrade. It's a radical reduction in the failure rate. Antibiotics actually cure bacterial infections instead of just suppressing them. Transfusions replace blood volume. Surgical intervention stops internal bleeding. These are categorical improvements, not incremental ones. A femoral fracture that probably meant months of vulnerability and a significant death risk can now be stabilized surgically in a way that allows for much faster recovery. But here's where it gets complicated, and where the question becomes more interesting than it initially seems. In gaining the power to intervene in injury and disease, modern medicine also created situations where people survive injuries that would have meant death in the ancient world, but they survive in a state of permanent disability. We keep people alive through catastrophic trauma that would have simply meant death before. That's an ethical good. It genuinely is. But it also means that modern societies have to manage a category of permanent disability that ancient societies largely didn't have to manage, because those people simply died. This isn't an argument that ancient societies were better. It's an argument that we're comparing different systems with different trade-offs, and we often mistake one for being simply superior to the other when what it really is different. The other complication is more subtle. In eliminating the need for the community to collectively manage injury recovery, we've also eliminated something that served a social function. The process of nursing someone through a serious injury, the redistribution of labor, the integration back into society, the ritual aspects of recovery. These created social bonds and demonstrated mutual obligation. It showed you that your survival depended on the willingness of others to absorb your burden. Modern medicine short-circuits this. The injured person gets treatment from specialists. The community's role becomes passive. The professional institution takes on the burden, not the people. I'm not saying we should go back. I'm saying that there's a real cost to this that we don't usually acknowledge. The cost is isolation during vulnerability. So we come back to the original scenario. You're in the forest with an arrow in your ribs. In the ancient world, your survival would depend on multiple factors working together. Your body's automatic responses would suppress pain and bleeding. If you're lucky, the wound would avoid major blood vessels and major organs. You'd make your way back to camp or stay still until someone found you. Once you got there, your community would apply whatever compounds and techniques they understood: honey, fire, herbal preparations. They would feed you. They would protect you. Over weeks and months, if infection didn't take hold, the wound would slowly heal. Scar tissue would form. You'd gradually return to normal function. That entire process would be structured around meaning. There would be rituals around the injury. The narrative of your survival would become part of the group's cultural memory. The fact that you survived would be taken as evidence of something: strength, luck, divine favor, whatever the culture believed in. And belief matters, because belief shapes behavior, and behavior shapes outcome. If your community believed you would survive, they'd invest more heavily in your recovery. If they believed you'd probably die, they might not. Modern medicine has removed belief from the equation as much as possible. That's good for reproducibility. It's good for standardization. But it's arguably worse for the psychological aspects of recovery, which matter more than we typically acknowledge. The nocebo effect is real. Belief in your treatment, belief that you'll recover, belief that your community is invested in your survival. These aren't just psychological frills. They affect immune function, pain perception, and literally the rate at which wounds heal. What this all suggests is that ancient humans were using a survival strategy that was sophisticated in ways that don't fit neatly into modern categories. It wasn't primitive. It was integrated. Biology plus knowledge plus social structure plus meaning-making plus ritual. It had a high failure rate. It was also often effective. And the people who survived it became the ancestors of everyone alive today, which tells you something about how well it worked as a selection mechanism. The uncomfortable question this raises is whether our modern approach, individualized, mechanized, denuded of ritual and meaning, is actually addressing the full problem of human survival and flourishing, or whether it's solving one problem while creating others. We've eliminated many causes of death. We've increased disability management. But we've done both in a context where the injured person is often isolated, treated as a technical problem to be solved, and then expected to reintegrate into a society that never saw them vulnerable. Ancient humans survived massive injuries because their survival was a collective project. That's the actual answer. And the question that follows, the one worth sitting with, is what we've replaced that with, and whether the replacement is really superior or just different in ways we've become comfortable with. The next time you see someone recovering from serious surgery or injury, notice how much of their recovery depends on whether other people show up, feed them, and simply exist in their presence. Notice how much of healing is still collective, no matter how much we've medicalized it. We're still biological creatures living in societies, trying to keep each other alive. We've just outsourced the visible labor to institutions and called it progress. And maybe it is. But knowing where that technology came from, understanding that human resilience has always been collective, might change how you think about what matters in recovery, both individual and social.